are the risks and what's the success rate?
Risk of the procedures will be, like any other procedure that we do in the spine, will be infection, bleeding. So for infection, we ask the patient to stop certain medications prior. For bleeding, we ask the patient to stop certain medications prior to the procedure. For infection, everything is sterile, and we give antibiotics during the procedure and during the length of the trial, so they don't get infected and they don't develop an infection that can be detrimental. And other things, obviously, since we're working on the spine, will be nerve damage, paralysis. But again, we're using X-ray guidance, so we know where we're heading with the needle and the device when we're implanting that.
How's the success rate?
The success rate, if we look, Medicare success rate is anywhere around 60-65% on patients. It can be brought up to about 90% if we have a very careful selection of the patient. So we know that the patient will be is a good candidate. They want to be active, and we are specific on the condition that we want to be targeting.
We've heard so much about that in the last 10 years, where people say my core strength.
Yep.
Years ago, we never heard about that. It wasn't a big deal. How much of a deal is it right now? How much should you be concerned with your core and the strength you have there?
Absolutely. Normally, the core, as you're well stating, core is just a thing that we have been hearing over the years, and we emphasize that on patient. And pretty simple. Explain to the patients, like normally the core is you have to think as a box.
In here.
In here.
Right.
So we have the box, which normally we have this the front, which is what people they think mostly of the core, which are the abdominal muscles or the six-pack. And then we have also the antagonist muscle, which is called the back muscle, the extensor muscles, that basically they do this type of movement. Then we have the top, which is the diaphragm, that reminds people of doing cardiovascular training. And then last but not least is just the gluteal muscle or the pelvic muscle, which actually incorporate the core. Not only one muscle has to be strong, actually we have to have the four faces of the box. They need to be strong.